health tax imposed to curb rising cases of obesity by reducing the consumption of sugary beverages and processed food has started showing some positive results in South Africa. According to a study published in the Lancet Planetary Health, there was a 51% reduction in sugar, a 52% reduction in calorie intake, and a 29% reduction in the volume of these sugary beverages purchased per person per day. And of course, that's following the implementation of the sugar tax. But there are now calls for South Africa to increase the health promotion levy amid high levels of obesity-related health conditions. Let's unpack the story for you now. We're joined by Professor Karen Hofman, who conducted the research, and she is with the School of Public Health at Wits University. Prof, a very good morning to you. It's great to have you on the show, and it's great to see these numbers as a direct result of that sugar tax. But according to your research, do you reckon a lot more can be done?
Yes, a lot more can be done and should be done, Michelle, and that is because the obesity is engulfing us. All of the obesity-related conditions, high blood pressure and diabetes, for example, are really killing South Africans in huge numbers. Together, they're actually killing more people, and heart disease and cancer, which are all caused by these sugar-laden foods and beverages. And they're killing more people, actually, than TB and HIV at this point. And worse still, most of the people that have died of COVID-19 have been people with obesity-related conditions. Yeah. So we know that this much more can and should be done, and the longer we wait and don't increase, the tax has not been increased for at least 3 years, and there's no tax on fruit juices, which in some ways are even more toxic. They're certainly not healthy, and we must eat our fruit but not drink it. And we need to say that each time we drink a sugary beverage with fruit in it, fruit is a sugar, and this is at least 10 teaspoons of sugar in a fruit juice, average sized 330 ml fruit juice. And for sugary drinks, cold drinks, it's close to 7 or 8 teaspoons of sugar. So yes, we've got a long way to go.
I mean, that's the issue here, exactly what you've outlined, Prof. The fact that our diets have such a wide-ranging impact on all our lives, and perhaps that's come to the fore even more so in the past year of the pandemic. It's not just about trying to eat healthy, but it's about the impact it has essentially on longevity.
That is correct. I mean, a lot of people are dying very young. They are having strokes from their high blood pressure, which is obesity-related and overweight-related, and they're also dying of they're getting blind, they're getting kidney failure from diabetes, and they're having amputations. The wards of the Charlotte Masheke Hospital in Gauteng are filled with people having amputations. They're no longer filled with people with HIV. They're filled with people having amputations from diabetes that have been caused by these consumer-driven, industry-driven commercial determinants of health.
So, Prof, you know, you were saying to us in your first comment in our interview that, you know, for a 330 milliliter glass of juice, there's 10 teaspoons of sugar. How many people do you reckon actually know what goes into the foods that they eat and drink?
I think most people have no idea.
Yeah.
I think when I started this research, I didn't know either. And let me say that the current labeling is really beyond inadequate. Okay, we need clear front of the pack to tell us this is too much sugar, this is how much sugar there is, this is how much salt there is, this is how much fat there is. I think that will go a long way, but more importantly, it will allow us to know which products could be identified as we need to stop marketing these products to children especially. Our childhood obesity rates are going through the roof. They've doubled tripled in the last 10 years. And once you're an overweight adolescent, teenager, it's really, really hard to lose that weight. It's, these things are really difficult to treat. We have to prevent them, so that understanding what's in our food, labeling, is one of the key issues. We did some work a couple of years ago showing how much sugar there was in baby food. It was shocking. Absolutely shocking. Nobody knows what they're eating.
Yeah.
None of us.
Yeah, absolutely. And I mean, in a context like South Africa, when we talk about the unaffordability of what should be a basket of goods for the average household, how much of that, the fact that it's so completely unaffordable for many South Africans, that average basket of goods, how much of that plays into how much sugar we are consuming as well?
I think it's part of it. I think a lot of the sugar-laden foods are very cheap.
Yeah.
But it's more about what's been marketed to us. We've been sold this story from the time that we're babies. Little toddlers know that, these products are cool, they're delicious. There are ways to change that. Nobody can tell me that one orange, costs more than a cold drink or a fruit juice. So depending on how you put that basket together, I think it's just how you do it and what you understand from what the environment around you. I think we live in a really unhealthy food environment where the foods that are, even in supermarkets, they put on certain number of shelves at eye level. It's pure manipulation, and these companies are paying for that. They're paying the retail stores to put those products in a certain place.
Yeah, absolutely.
You go down the checkout aisle of any supermarket or a chemist, and you can see. I mean, you're surrounded by this kind of stuff, and especially in the chemist shops, it's unbelievable to me. These are supposedly places where we go to get things that would help our health.
Yeah,
so
absolutely.
They sell you vitamins on the one side and, medications that you need for your health on the other. And as you go out, they say, here you go. Just poison yourself a little bit more before you leave. Thanks.
I mean, there was at one stage a drive, especially at checkout aisles, to stop stocking sweets and chocolates. But I'm not sure whether that's still in effect, because as you say, just going to the pharmacy, you stand at the till, and there you have it. You have a whole range of sugary sweets and snacks that you can get. But Prof, I want to just, as an end off to our interview, talk about, this was the 2018 sugar tax. Is the research that you're doing and part of the recommendations you're making saying that we need to relook at the sugar tax again
yes.
and increase
yes.
it? Yeah.
Yes, so I think that the WHO, the World Health Organization, has said we need a 20% tax, and the tax right now is sitting around 11% and hasn't even increased with inflation.
Yeah.
So this is not good news. And while we sitting around chatting, people are buying these products, and we need a tax to tell people that this is not a healthy product, and label it and ban the marketing to children. That is the beginning of a series of things that need to happen.
Yeah, absolutely. Professor Karen Hofman, thanks so much for your time this morning. Such an incredibly important discussion. She's with Wits University's School of Public Health, and it's all around the burden of non-communicable diseases on our country's healthcare system, things like diabetes, hypertension, cardiovascular diseases, and so many others. And of course, it's linked as well to COVID-19 and the people who do, in many ways, get more seriously ill as a result of the virus.